This is All India Radio. In the program Spotlight, now we bring you a discussion on COVID-19 updates with focus on India's comparison with the world. The participants are Sandeep Dixit, senior journalist, and EIA correspondent Anand Chaturvedi.
Mr. Dixit, government is saying that India has performed well in comparison to the world in dealing with the corona pandemic. What is your view regarding this?
So far, India has performed well, but as the entire world acknowledges, as the PM also acknowledged, we don't know what is going to happen in the days ahead because COVID is an unprecedented situation. We never faced such a kind of a situation before. So what is going to happen ahead, we don't know, but so far, what we have seen is the national lockdown has not completely broken the chain, but the chain has frayed. In fact, there have been official comments as to how, had there not been a lockdown, what could have been the mortality rate and what could have been the infection rate. That was really very scary. And India did not enter into that situation because of a very strictly enforced national lockdown, which was also backed by a number of relief measures to help people. Although with a 135 crore population, it is not possible to do so. But this period of national lockdown was used to gather our strengths in the medical field and to prepare ourselves for a rise in COVID epidemic. And so far, India has handled it very well in the sense that there has been no shortage of beds, there has been no shortage of doctors, no shortage of medical assistance to various patients. India's public health system, which has been backed to a certain extent by the private health system, that has stood up. So the attention that has been paid to the public health system of India over the years by successive governments. At the same time, there have been a lot of efforts that are going on by the government, such as the testing procedures that are going on, the help to the migrants that is going on, and to ramp up the production of PPE kits, for instance, and ventilators. So India is really at the forefront of the fight against COVID epidemic. And so far, the statistics have been satisfactory for us. And the statistics, whether it is in the recovery rate or whether it is in the doubling of the infections or whether it is in treatment of the patients, India's record has been exemplary as compared to other countries in the world. And the WHO had also commended India's fight against COVID, and so did the United Nations. And both these organizations, as we know, they monitor the health of at least 190 countries. So when praise for India comes from these organizations, then it has meaning, and it concretely shows that a lot of the effort that India has put in the fight against COVID is paying off.
Mr. Dixit, the fertility rate in the country, as you just mentioned, is remarkably less, as is, if I'm correct, 2.83%, whereas in the world it is around 6.3%. In a country where more than 130 crore people live and a huge infrastructure, health infrastructure is needed, how do you think India is performing way better than the other countries of the world?
India really did go in for a national lockdown very early. The policy making in India in keeping COVID at bay has been successful. And as you know, we've had 0.3 deaths per lakh of the population as against 4.5 lakh deaths globally, which is the lowest in the world. So what can you put it down to? You can put it down to a timely decision taken for a lockdown, for identification and management of COVID cases. As you know, earlier, if one positive case was detected, our health authorities, the police and everyone, they went to great lengths to trace the contacts which he had made and to put them into quarantine. So those early efforts, that vigorous effort that was made by the structure of the Indian state, that has helped, which was missing in a large number of countries. Number of countries did not have such a public health system. They were dependent on insurance and private hospitals. So there was a delay in people approaching those hospitals. And in many places also, they were very lax. In fact, Italy paid the price for that, so did Sweden, and so currently is Brazil. And what we are saying is that their deaths per lakh of population is many, many times more than that of India. So the statistics put it very clearly where India stands and where other countries that are badly affected by COVID stand. And the reason behind it is quick policy decisions that were taken on the lockdown to swallow the bitter pill of extending the lockdown in order to save lives.
Mr. Dixit, we are also seeing a continuous and steady improvement in the recovery rates, which are nearly more than 42% today.
Yes.
So do you think that the government efforts are actually proving right, and whatever the decisions they have been taken are actually in the right direction?
I would say both the government and the citizens. As you would have noticed in your locality and everywhere, people are staying at home out of their own will. So there's a contribution that is coming by the citizen, and the government has been constantly messaging the population about the need to take precautions against COVID. It appears that the messaging by the government has been successful in helping the citizenry, the people, to take sufficient precautions against COVID. So that has also resulted in a drop in the infection rate. You would be seeing visuals, for instance, of other countries, how people are flocking to the beaches and how they're protesting the lockdown. In India, in contrast, people accepted the decision of the national government as well as the state governments in extending the lockdown, in putting in place measures that did cause convenience, but it has saved lakhs of lives.
When we talk about the preparedness of the health infrastructure in the country, so at the onset of this world pandemic, we saw that we rarely had any PPE manufacturers and N95 mask manufacturers in the country. But today we see that more than 2 lakh kits produced in a single day. So do you think India's health infrastructure has picked up pace to deal with the worst conditions in this situation?
Well, you remember the Prime Minister had spoken about Atmanirbhar Bharat. So this is a sterling example of Atmanirbhar Bharat, where e-kits and N95 masks, these were really unknown things in India. We never required it, so no one ever produced it. The medium, the small-scale industries and even the corporates have risen to the occasion, have matched the appeals made by government to domestically manufacture PPE kits and N95 masks. So that today in the situation, as you see, it has improved in the sense that PPE kit and N95 masks are available universally for the frontline workers, including the health workers, the police, for instance, and the chemists. So PPE kits, N95 masks, I suppose, is just a beginning, and I hope and visualize that in line with the call of the PM for Atmanirbhar Bharat, in fact, we will go on to produce indigenously medical diagnostic kits also of various types and other medical instruments which we are importing. So far what we have seen, we will completely now stop after some time imports of PPE kits and N95 masks. And this is the first step in the direction to becoming Atmanirbhar in health. Thing that all countries in the world have realized that imports in health emergencies are a dicey thing, may or may not come. It's always better to be self-sufficient.
You talked about diagnosis regarding the treatment of this pandemic, and if I remember correctly, yesterday even the principal scientific advisor to the government of India, Mr. Vijay Raghavan, he also said that diagnosis is one of the key areas which should be addressed in order to contain the pandemic. ICMR has ramped up the testing facilities also in the country in the various labs where more than 1 lakh tests are being done every day now. So what is in your opinion, how India has reached to such a remarkable milestone in diagnosis, and what more can be done in this field?
As I have been stressing the point that India had prepared for this earlier, and there has been constant messaging from the government to the citizenry, for instance, to take precautions, and similarly from the specialists that are with the government of India. You mentioned the principal scientific advisor, Professor Vijay Raghavan, and he has been making the points on diagnostic tests, on drug and vaccine development for over a month now. And this is the constant messaging that they have been giving from an empowered committee that was set up by the Prime Minister for COVID response. And as part of it, they have been trying to make a rapid diagnostic available on demand to allow early detection and distancing, because I have not mentioned that there are 2 stages for testing for COVID. One is rapid diagnostic and the second is then the much more deliberate test. So that is required. We have really ourselves for that and are going ahead with it in a big way.
Mr. Dixit, amid this world pandemic, we have seen that India has continuously cared for its citizens, whether they are in the country or abroad. And we have brought almost 45,000 Indians back to the country through a series of flights under Vande Bharat mission. And yesterday, even the MEA said that we will be bringing more than 1 lakh people to the country back. So how do you see country's effort to bring back stranded Indians from abroad, and as well as to addressing the migrants, workers in the country itself by running the Shramik special trains?
The first question which you asked about Vande Bharat, it has to be broken up into three parts. There was phase 1 of Vande Bharat in which about 16,000 Indians were brought back. There were 64 flights and I think 2 naval sorties in that. And now what we are seeing is the ongoing phase 2 of the mission, which as you have rightly mentioned, about 45,000 people have come back. And this phase 2 will last till June 16. So another 55,000 will come back till June 16. But of course, this also includes people who would be coming by land borders from Myanmar and Bangladesh, as well 4 naval sorties. And as far as flights are concerned, as I mentioned, first phase was 64. So you can understand the enormity of the second phase, that it will be at least 450 flights. But the mission is not over yet. About 3 lakh Indians have registered with all Indian embassies abroad, which means there would be a phase 3 also after June 16. And in phase 2, what we have seen is a rapid expansion of the Indian footprint. So in phase 1, planes went to known destinations like UK, Canada. But in phase 2, we are seeing planes going to Costa Rica, for instance, or Guatemala or Congo, bringing back stranded Indians from there in various hinterlands of the world. And in that sense of scale, I can make a comparison. Yesterday, the High Representative of EU Foreign Affairs, Mr. Borrell, he spoke to External Affairs Minister Jaishankar, thanking India for sending back 11,000 EU citizens. So just 11,000 EU citizens. As compared to that, our phase 1 itself has picked up 16,000 Indians. So it is a gigantic operation, and perhaps I would stick my neck out and say it would be the world's largest evacuation that is taking place today. And from the Shramik specials. So that's Shramik special trains also. That is also a huge logistical operation that is going on. And in this, I would like to refute this view on social media that trains are getting lost. This is because of immense congestion at the receiving points. To give you a view, 25 lakh passengers in 5 days were deboarded at just 3 stations of Lucknow, Varanasi and Gorakhpur. And each station there's a medical checkup done. So the platform takes time to clear, and that is why trains were diverted by other routes. They did reach their final destination.
Mr. Dixit, as we know that we just 2 days remaining of the lockdown 4th phase, what do you have to say about the life after this lockdown gets over and life beginning from the 1st of June?
All countries are preparing for life after COVID, or in other words, learning to live with COVID while doing business. So India is also preparing in that respect. And as you may be aware that the task force on rupees 100 lakh crore national investment infrastructure, they have submitted the report. And soon work is going to start on what was being done pre-COVID in building up India's infrastructure to world standards. And of course, a lot of hand-holding is also required.
So what you are saying, Mr. Dixit, is that we'll have to inculcate in ourselves the habit of living with COVID for some time now.
Yes, living with COVID for some time now, as well as imbibe the lessons of Swachh Bharat earlier. So this is an extension of Swachh Bharat in a sense where we maintain personal hygiene, where a new thing, of course, is in physical distancing. And then, of course, a lot of precautions we take while eating, while stepping out. Basically, citizen consciousness that is at work. And governments can really do that much and not more if citizens do not cooperate. In India's case, we have seen that the citizens have stood by the government.
What advice that you would like to give to people to imbibe from after the lockdown gets over, or maybe if it is extended as well? So what is the policy that people should adopt 4th phase of lockdown gets over?
After the 4th phase of lockdown, one shouldn't speculate. But what we will see is that there will be freeing of some more activities. What we are seeing at the moment is that the industries that have opened have now reached about 25 to 30% of the capacity. So workforce is less, so social distancing happens. But after that, when the activity really picks up to 80%, 90% or whatever, then there is going to be a lot of intermingling, and that is the time, maybe 15 days or 10 days after the lockdown is over, that we have to be extra careful and ensure that the infection rate stays low and that we don't contract the infection rate while trying to pick up our lives again.
Thank you very much, Mr. Dixit, for speaking to us.
Thank you, my pleasure.
You are listening to a discussion on COVID-19 updates with focus on India's comparison with the world. The participants were Sandeep Dikshit, senior journalist, and AIR correspondent Anand Chaturvedi. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on Air. This program is also available on our website, newsonair.com.